Welcome back to Medical Monday. I have Dr. Brian Tierney here with me, a board-certified plastic surgeon. You operate, well, your business is in Midtown. You operate all over because you are, you have your own office. We've been talking about all kinds of different procedures. We're calling this the Mommy Makeover Show, which a lot of women are asking for these days. They've had their children, and I guess I should ask, you know, for the breast augmentations or lifting and the tummy tucks, should you wait until you are done with having children?
Definitely. Okay. Definitely wait. So tummy tuck would be ruined.
Yeah.
With another pregnancy, and pretty much the breasts wouldn't be as bad, but still, you don't want to have to get a lift or something down the road after you've already had surgery and go through another recovery.
Right. So
expense.
Just wait until you're done with the kiddos.
Yep, that's correct.
Okay. And is there an age where you say you're too young to do this or you're too old to do this?
Well, for silicone implants, you actually have to be over 22, but over 18, pretty much for any procedures. Yeah. Okay. Sometimes someone who's 16 and needs a breast reduction, there's special occasions where, with the parents' consent, that might be an indication to do. So.
Okay. Good guidance there. Let's also talk about something I know a lot of women struggle with, and that's the way their neck looks.
Right.
And you have an interesting procedure that you're doing that's finding some pretty good results.
Right, really nice results. It's called Thermi-Tite.
Okay.
And it's a radio frequency heat energy that you can deliver in the office, and it is done under local, where you can just numb up the neck and you can tighten the skin. The collagen improvement and remodeling and tightening is amazing, and can go over a period of a year. So your results are going to improve through a year, and you're going to tighten the skin. If you have some extra fat, you can also do a little liposuction in the office. So this is all done in the office. You go home a day or two over the weekend to not do too much, but just kind of stay in with a little dressing, and that's about it. It's a really nice procedure. Is it a one-time thing,
or do you have to do it over a couple of months?
It's just a one-time.
One time,
yes.
And then you see the results kind of stack up over about a year?
It starts probably about 2 months where you really start seeing the results, but they are pretty amazing. I actually have a couple pictures on my website, and it is amazing, the before and after at 2 months for an office procedure.
Yeah.
It's really impressive.
And before this came about, those kind of results would have to be done in a facelift?
Pretty much, yeah. So there's really not an easy way to get rid of the extra skin of the neck, because you just can't cut it out.
Where's it going to go?
Yeah, you got to cut it out. So the facelift is the only way of doing a surgical procedure, but with this Thermi-Tite, it directs the radio frequency heat right to the dermal tissue, which is where the target is, where you want to be, and that's why it's only a one-time deal. It's not like a laser that goes from the surface down and trying to get the heat, where you have multiple treatments. This is a one-time, and that's it.
And what does it cost?
Neck is about $2,500 in that range. So you could also do your lower face.
Would it take care of a double chin?
It would take care of a double chin, yeah, definitely.
Interesting, very interesting. I have to ask this, since you brought up facelift, do people get facelifts anymore?
Oh yeah.
With all the fillers that are out there?
Not as much, it's not as popular. Most people are going away from surgeries like that, and things like this Thermi-Tite, fillers, Botox. You could do things like eye surgery in the office, so you could excess skin of the upper eyelid. So you could do things around the face with pretty minor procedures that really make a big difference.
Yeah, and I think that's what a lot of people are looking for. They don't necessarily want to go under the knife in such a drastic way that a facelift requires.
Well, it comes with a lot of risk too. So these are very low risk procedures and a lot less expensive.
Now, the same device that you use for the neck tightening, you can also use a little bit lower on the body for also some good results. And this is a topic that kind of is like, well, should we talk about that? But a lot of women especially deal with these issues. So I do want to talk about it. I want to put it out there on the table. We're talking about vaginal rejuvenation.
Right.
What is that?
So with different devices out there, and this Thermi-Tite device also has a Thermiva. Okay. So it's a device that can treat both internal and external, and it is done in the office. Again, it's a pretty painless operation, and it is a 3-treatment regimen that you do every month, 3 treatments, and the results are amazing. As far as we're talking about the Mommy Makeover, and some of the laxity of tissue, so it could tighten tissue up, internally, externally, menopause type patients, again with the dryness, this can help with that, and also with bladder leakage, which is a huge
issue for moms who have given birth and things just don't work the same.
This can be a non-surgical correction of that. So it's pretty amazing.
And this is relatively new.
Relatively new. This machine, radio frequency, that Thermi has been out for a little while. I've had it for about 3 years. And then this Thermiva is even newer than that, probably about 2 years, a year or two.
What are your patients telling you about this?
So the feedback's been pretty amazing. So it has stopped the bladder leakage. Everything as far as the rejuvenation has been improved. Some of even the husbands are commenting, and the feedback has been positive there as well. So it's done everything it's advertised.
Because you want your life to go on after having children, and that is part of it, right?
That is correct.
And it's an important part of it.
Yes.
When you as a doctor are looking at new things that come on the market as far as these devices, what do you double check and triple check just so you make sure that you're doing the right thing for your patients?
Well, number one is the demand as far as is something needed. When I got the Thermi Tight device, it was with the neck. A lot of people would come in and say they wanted a procedure on their neck, but they didn't want to have surgery. So I started looking into devices, and then I talked to colleagues around the country that might have that device, and talked to them directly, and not a salesperson, about does it work? How do you do it? How does it fit into your practice? And go out and get some real discussion with doctors that have used the device. When Thermiva came along, it was the same thing. I asked some other colleagues, but this realself.com that we talked about too, you could get on there and you could see a patient's response to different devices. And you'll see, like Thermiva, last time I checked, it was somewhere like 96% satisfaction with it. So when you have something that's high and you have 4,000, 5,000 reviews, it's doing something
that speaks
supposed
volumes.
to be doing. Yes.
Yeah, absolutely.
Right.
Let's dial this back a little bit and just talk about the mommy makeover in general, which a lot of plastic surgeons are saying, I offer the mommy makeover, but it's really up to the woman to say, these are the procedures that I am interested in, whether it's a breast augmentation and or the tummy tuck, or maybe a butt lift, who knows. But how many procedures is too many?
You always want to make sure that the risks of each procedure and not doing too many in a row is all discussed. So that's why if you have a kind of a list of priorities, what really bothers you, and if there's a couple different things, you may want to have different surgeries at different times with enough spacing between them to be able to do them safely. Because if you have anesthesia multiple times, week after week, it's not a good thing. So, so you definitely don't want to get kind of hooked on some of these procedures and get addicted to the surgery. But you don't really see that. I mean, if you're going to good plastic surgeons, they're going to kind of focus things on okay, let's do this set of procedures to correct this problem, this problem, then we'll look at something down the road. Are there any of the procedures that you can do at one time? So yeah, as far as the mommy makeover, the breast and tummy procedures are a great combination. That's a pretty common thing? Very common. So you can do whatever breast lift, implant, and then a tummy tuck, do some liposuction. You like to keep the surgeries down. I like around 4 hours is a good kind of general rule. Sometimes you can go a little bit above that if the patient's very healthy and so on and so forth. But around 4 hours is a good rule as far as a one-time procedure. And then waiting plenty of time to recover from that and just kind of getting back into normal life, and maybe looking at 3-4 months down the road of having something else done. Walk me through what a patient should expect if they were doing the breast augmentation and a tummy tuck together. What are you feeling in the few days afterwards, and then what results should you expect and when? So you'll start seeing results pretty much in a couple weeks. You'll see right away some differences, but you're going to have a lot of swelling and bruising, a lot of pain. That medication I spoke of before with numbing the belly, so that right away you're not going to have a lot of pain with that, but it's going to be a couple of weeks where you're recovering, and you're not going to see a whole lot of improvement until probably about 6 weeks. You really start looking at that. At 3 months, it's going to be probably about 90% of what you're going to see. Okay, easy enough. We have another caller on the line. Liz is with us tonight. Hi, Liz.
Hi there.
Hi. Go ahead with your question.
Well, I'm turning 50 this weekend.
Happy birthday.
never really been a big fan of my breasts. My breasts had 2 kids, and my husband told me I was too old to get breast implants, which I disagree. And so I was wondering what the doctor thought about a 50-year-old getting breast implants and what the size would be for somebody. I'm on the shorter side. I'm 5'2", about 115 pounds, so I didn't want to get anything big, but I also wanted to look good in a bathing suit and not have to wear a wire bra my whole life.
Okay, great question.
Sure, good question, Liz.
Is 50 too old?
50 is not too old, no. So you definitely would be a good candidate for breast implants. You don't want to go too big, it sounds like, but you want to fill things back out. So, you know, somewhere probably around the 250, 325 range cc's would be a really good place. That's kind of where I would start. Like if you came to the office to try on some implants, that would be the range I would say to you start at and see how you like that. It's also good to bring maybe a t-shirt in or something so you can also see how it looks in clothes, which is a really good idea. But no, you're definitely not too old, and you know, a small implant, sounds like you would really enjoy that.
All right, Liz, thank you so much for your call.
Thank you so much.
Thanks, Liz.
Now, you say that's a small implant. Would you say the majority of the women that that you perform a breast augmentation on are going on the smaller side, or are you saying they're going big?
Most of them are going small.
Really?
Yeah, most of them are going pretty small. It's funny how most people that come in will say, well, I'm not like most of your patients, I want to go small. I hear that more than anything else. Because most people really want to go natural. You know, they don't want everyone saying, oh, she had a breast augmentation. They just want to be natural, fill things out, and go, wow, she looks really good. So that's where, you know, 90% of the patients.
And would you say, as a surgeon, that, I mean, it is kind of an artwork, I would think, you know, finding the right size and the right shape for that person. Is that developed over time as a surgeon?
Sure.
That ability?
The ability to kind of figure out what that patient wants and to be able to deliver on that is a very difficult thing to kind of learn, because you could do a perfect operation, but if that patient isn't happy with it, if they wanted something else, if they wanted more fullness and they look more natural, they could be very unhappy with it. So you have to make sure you listen and be able to deliver what you're saying that you can deliver on.
So in your office, walk me through what happens before the surgery, whatever surgery that is. So
before surgery, you'll come in consultation, you'll meet the nurse with me, and we'll discuss, as far as the breast augmentation, we discuss the size, the location of the incision, what type of implants, and I'll show all the different implants, and just have an open discussion what they're looking for. Sometimes people will bring in pictures and say, I'm looking to be like this, and sometimes that can be helpful, but you have to be realistic. You know, not everyone's going to come in and be a model with that, or not everyone's going to have a look like a pushed up Victoria's Secret bra. So you have to have some realistic things. So that's where you can kind of discuss things and see if that patient's realistic about what to expect.
And then you prep them for surgery. What do you say that needs to be done before surgery? I mean, how do you prepare someone for that day?
Well, as far as, you know, they can't have any medications that make them bleed, no aspirin, ibuprofen, those sort of things. So you have to go through medication lists and things like that. Otherwise, it's just about, you know, that you're feeling good, you're not sick, you don't have a fever, you know, all those sort of things. And then if they're healthy and ready to go, anesthesia will also do a kind of a history and make sure you're going to have a safe anesthesia, and there's some things there and some lab work that you might need, but it might just be a couple little things on labs, and that's pretty much, if you're young and healthy, that's pretty much all you have to do.
And then the follow-up after surgery, what happens? So
follow-up usually weekly for the first couple of weeks. So if there's a drain, as there is an abdominoplasty, that would come out usually at the week. Breast surgery usually doesn't have drains, so you don't have to worry about that. But usually first week, come in, make sure everything is looking good, get some of the dressings off, and then follow up the week after that. And then just depends on the procedure and distance they're traveling and things like that.
Now we're talking about the mommy makeover. Is there advice that you give to mom, if even small kids, of, hey, listen, you've got to worry about this after surgery?
Well, lifting, you know, lifting restrictions. If you have a really young one, you know, with a tummy tuck, you're not going to want to be picking up, you know, 15 pounds or something like that for at least 2-3 weeks. So that could be an issue, or just running around if you've had a breast augmentation and running after 2 or 3 year old, that could be an issue as well. So you have to be careful for at least a week or 2 after these surgeries to make sure things heal.
Yeah. Okay, you have to give yourself time. We're going to come back. We have one more big segment. So if you have a question, if you're sitting at home saying, should I call in and ask this question? Yes, you should. You should do it during our commercial break, and we'll get it answered right after. The number is 615-737-PLUS. We'll be right back.